Good morning. Let's talk about how to give profound and painless anesthetic with a mandibular block. Many of you have asked for this. So we first use this topical anesthetic that has lidocaine, procaine, and tetracaine and apply that in the coronoid notch in the pterygomandibular depression. And we'll let that sit for about a minute. And then we'll spray that area with hurricane topical anesthetic. And then I'm going to blow that in. Now you can see the pterygomandibular raphe, and this is the pterygomandibular depression. When you give the local anesthetic, the syringe is parallel to the occlusal plane, and you're going to place your finger in the coronoid notch. That's this area right here, right there. This is the ramus of the mandible. This is the pterygomandibular depression between the raphe and the mandible. So you're going to place your finger right there. The syringe tip is going to split the fingernail at the occlusal plane level right there. You're going to blow that topical anesthetic in. Now I'm going to begin with a 30 gauge needle. This is a 30 gauge needle with sit nest plane. The reason you always begin your local anesthetic with sit nest plane is because it's pH neutral and it does not sting. And always begin any local anesthetic with a 30 gauge needle. Now you see I'm bending the tip of the needle in this direction. See, here's the bevel on this side. Now watch this. You want the bevel of the needle to be toward the midline of the throat. You want the tip of the needle to be pointed toward the mandible. Watch what happens when I put this needle into this hydrocolloid. See how it went that way? This is the tip of here's the tip of the needle, and the bevel is on this side. You want to bend the needle just a little bit. When you give the injection, the tip is pointed toward the bone, and it will move the needle in that direction. If you have the bevel toward the bone, then the needle is going to go in the direction of the tip, and it's going to go away from the bone. So if you're having a hard time getting the needle to go toward the bone, you probably are bending the needle, or you have the bevel toward the bone. You want the bevel toward the midline, and you want the tip toward the bone. Watch that again. There it goes this way, and there's the tip. Can you see that? The tip is over here, the bevel is over there. So that's one of those small but critical factors when you're giving a mandibular block. Okay, so I bent the needle so that the tip is this way, and I'm placing this 30 gauge needle in the pterygomandibular raphe, which is that little pterygomandibular depression, which is the little depression between the pterygomandibular raphe and the bone. And you're splitting your fingernail, and the syringe is parallel with the occlusal plane. Now I'm giving this backwards. A lot of people like to put, if they're giving a mandibular left injection, they like to put the right thumb in the coronoid notch and split that fingernail with the syringe right at the tip of the finger, and keep the syringe parallel to the occlusal plane. That's probably even easier. We're going to do the other side here in just a minute. And that will take the tip directly to the bone because it's going to push it that way. And you're injecting the carpule of sit nest plane first. Now this is a 27 gauge syringe, and this is either lidocaine 2%, 1 to 100,000 epinephrine, or Marcaine 0.5%, 1 to 200,000 epinephrine. I use the Marcaine if I'm taking out wisdom teeth or doing some kind of surgical procedure and I want it to stay anesthetized for a long period of time. The mandible will stay anesthetized about 12 hours if you use Marcaine. Sitting as plain, it'll stay anesthetized for about an hour. And lidocaine, it'll stay anesthetized, the mandible will stay anesthetized for a couple of hours. So the Marcaine is the longest lasting, lidocaine second, sitting as plain is the shortest lasting, but the sitting as plain is pH neutral, so it doesn't sting. So I start with the 30 gauge, sitting as plain. I'm coming back with the 27 gauge, and in this case, lidocaine. See, here's the tip of the needle, and I'm bending the needle a little bit toward the tip so I can keep my bearings and remember where the tip is, and then that tip is going to move in the direction of the bone. It's not going to move out into the soft tissue. If you put the bevel toward the bone, remember the needle is going to go toward the tip and that needle is going to go out into the soft tissue, and you're going to have a hard time anesthetizing the mandible. You're going to have a hard time giving the block. So you're going to hit bone right here at about 20 to 23 millimeters. This is the other side. You can see the pterygomandibular raphe, the pterygomandibular depression, and this is the coronoid notch right here. So I'm applying this topical anesthetic and then spraying the hurricane, which is benzocaine. And I'm going to blow that into the tissue. You're going to blow it in, it's going to penetrate probably a millimeter, and that's the depth you're going to go with your 30 gauge needle. So here's the 30 gauge needle with sitting as plain. Bend the tip, bend the needle toward the tip. Barely penetrate the tissue and then tap the end of the syringe to inject just a little bit of the sitting as plain, and then let the sitting as plain stay ahead of the tip of the needle. Tap the tip, let some sitting as plain penetrate the tissue, and then move the needle a little bit further until you contact the bone. Now, if you're using this 30 gauge and you've got the bevel of the needle toward the bone, you're never going to hit the bone because that needle is going to go the other direction out into the soft tissue. You want the tip of the needle toward the bone. Then I'm going to take that off and I'm going to inject about a half a carpule or a whole carpule of the sitting as plain. It doesn't have any vasoconstrictor, and remember it's pH neutral. Then I'm going to go with the 27 gauge needle and the lidocaine. See, and I've bent this needle just a little bit toward the tip. The tip's on this side, the bevel's over here. So I want the tip to go toward the bone, toward the mandibular bone. Now you don't have to go so slowly now because you've anesthetized the tissue with the sitting as plain. That's the objective of the sitting as plain. It's not a profound anesthetic and it doesn't last a long time. You're using it to anesthetize the tissue before you anesthetize the teeth, before you give the actual block. So see, now my tip is going toward the bone. I've got my thumb in the coronoid notch right here, and I'm going to split my fingernail across the occlusal plane, and that'll take you directly to the mandibular foramen right there. And once you hit the bone, aspirate and then inject a half to a full carpule. So see this, the big deal with this is you want the tip toward the bone, and that's going to take the needle in the direction of the bone and not out into the soft tissue. If you're not able to anesthetize these patients profoundly when you give a block, it may be something as simple as you've got the bevel toward the bone. You want the bevel toward the midline of the mouth. And that'll take it right to the bone, aspirate and inject. Now remember, this is not all there is to making a mandibular tooth numb. You've got to also give intraligamental, and we've got that in other videos, but this is only on how to give a painless and profound mandibular block. That's the Dental Minute. These techniques work, and they work every time. click on the blue link in the description below to register for dentistrymasterclasses.com if you really want to take your practice to the next level. There's an organized library of all the Dental Minute videos, plus many complete comprehensive cases not seen in Dental Minute videos.